Show.
All right, y'all, Rick Smiley Morning Show is Wellness Winning. We got the one and only Dr. M.J. Collier on with us this morning. Dr. Collier, good morning.
Good morning, Rickey. Good morning.
Happy to have you.
Thank you so much, Rickey. Rock T, Special K, Gary with the T, Maria Moore, and the Brat. Thank you so much for the opportunity to bring healthcare information to the listeners of the Rickey Smiley Morning Show. So, Rickey, this is National Breast Cancer Awareness Month, so we're going to give you an update. We can expect 310,000 women this year to be diagnosed with breast cancer. But surprisingly enough, there'll be almost 3,000 men diagnosed with breast cancer. So, men, you have to be well aware of potential things as well. There is some good news, though. When breast cancer is diagnosed early, the 5-year survival rate is now up to 99%. So we just need to be aware of our bodies and aware of potential symptoms. So risk factors include being your age, being born female, inheriting genetic mutations, having a family history of breast cancer. That's in a first-degree relative like a mother or sisters or aunts on your mother's side. All of those are situations you have to be concerned about. Having dense breast tissue. If you start your periods early in life, and a lot of girls are starting now as young as, say, 9 years old, or if you go through menopause late, this basically translates to prolonged exposure to estrogen in your lifetime, and that can predispose you to a breast cancer diagnosis. So having any of those risk factors doesn't mean you will get the disease, but you are at high risk. So signs and symptoms of breast cancer include breast or nipple pain, swelling of part or all of the breast, nipple retraction. If you see a nipple that looks like any belly button, that's a direct sign, particularly if your nipple used to be out and now it's being pulled in. That's a direct sign. Changes to the skin on the breast, redness, dry skin, flaking. There's a condition called peau d'orange, that's P-E-A-U, where the breast tissue looks like an orange peel or that consistency. That is a direct diagnostic change that's consistent with breast cancer. If you have a discharge from the nipple other than breast milk, if you have swollen lymph nodes under the arms or the collarbones, all of those could be symptoms of breast cancer. So one, screening and annual tests are a great way to diagnose breast cancer. So a screening mammogram, now they have what they call a screening mammogram, a diagnostic mammogram, breast ultrasounds, or even breast MRIs. All can give you a reason with abnormality to get a biopsy. A biopsy is the only way to confirm a diagnosis of cancer or to rule out a diagnosis of cancer. So if you've had a diagnostic test and a biopsy has been recommended, don't hesitate to move forward with that, because that will answer the question definitively. This watchful waiting and getting mammograms every 6 months makes no clinical and logical sense in this day and age with the technologies that are readily available. Get a biopsy and make sure that you know what's going on. Take care of your bodies. Limit alcohol use. Multiple studies are linking alcohol use with breast cancer, and of course tobacco use if you smoke. It's related to various cancers, not just lung, but also breast cancer. Remain physically active, and I know Maria agrees with this recommendation, to maintain a healthy body weight, because excess body fat predisposes you to breast cancer. And breastfeed. The Brat can relate to that. Breastfeeding decreases your chance of getting breast cancer. So there we are, Rickey.
Oh, wow. That's good stuff. Let's go to the phones. You're on with Dr. Collier. Good morning.
Good morning. This is Paulette from Durham, North Carolina. I wanted to know, my doctor said I have dense breasts, and I wanted to know what causes it and how can I correct it.
Okay, you can't correct it. That's just the nature of your breast at this point. That makes it more difficult to find breast cancer with a traditional screening mammogram. That means you're probably going to always have to have a diagnostic mammogram, including or a breast ultrasound. So it just makes it more difficult to see that. Dense breast tissue is just kind of the way that your body is made. It's not something that you became or something that changed in your lifetime. That's just the way that your breasts are. And so you need to make sure that you're getting diagnostic mammograms.
All right, you're on with Dr. Collier. Good morning.
Hi, I'm calling from Columbus, Mississippi, and my question is about my blood pressure number. My bottom number has been being high lately, and I was trying to see what can cause your bottom number to be so high.
Okay, the bottom number or the diastolic is the most important diagnostic tool when you're talking about high blood pressure or hypertension. So that can be related to stress. It can be related to, again, chemical changes, a stress hormone that your body releases from your kidneys that makes your blood pressure go up under stress. But it doesn't matter what the reason is. The point is that if it's been diagnosed and is consistently elevated, that increases your risk of a heart attack or a stroke or a cardiovascular event by up to 300%. So embrace the need to treat an elevated blood pressure. Let's just not ignore it because it's symptom-free. They call it the silent killer, and that's why, because you don't have symptoms until you do. And those symptoms are usually a major event like a heart attack or a stroke.
All right, y'all, Dr. Collier, good morning.
Hi, I've been having swelling in my feet and my hands lately. I wanted to know what that might be caused by.
Okay, you're having edema in non-dependent areas like the hands, so that means that you could be retaining fluids for a variety of reasons. Too much salt in your diet, if you're snacking on things like potato chips or using extra salt in your food preparation or when you eat, that could cause fluid retention, but also can be something as dramatic as congestive heart failure. So it depends. If you have high blood pressure and you're not on a low-dose diuretic or water pill, as we say, that would be something to add. But if this is a new change, you need to have it evaluated because it could indicate anything from uncontrolled high blood pressure, congestive heart failure, or chronic kidney disease.
Yeah, them damn Miss Vicky's sour pickle potato chips had your damn feet and hands swole up and the roof of your mouth tore up like some damn dry-ass Captain Crunch right in the bowl. I swear. You can eat some potato chip, but damn, Miss Vicky's, if you have to have dentures, only dentures.
Kettle.
Got doggone kettle, them hard-ass Miss Vicky's potato chip, they be getting you on the airplane. You get the one with the sour pickle and salt.
Yes, sir, them deals.
Sitting up there having a stroke on the plane by the time you land. Mouth tore up, mouth bleeding like you done been to the dentist. Hard ass potato chips special K. What kind of grease they fry Miss Vicky's potato chips in, K?
Motor oil.
Old motor oil. Motor oil out of a car that's being the oil change.
Your hands be looking like water balloons. You get out the plane, you can't even take your shirt off. Your hand won't go through the sleeve. You just
gotta have somebody cut your shirt off from the back. Like a paramedic when you're in an accident. They cut your clothes off, your head so swollen up.
Special thanks to Mayor Wayne Messam in Miramar, Florida, and his executive staff members, Tiffany and Carla. We had a men's health event last weekend featuring myself and Alonzo Mourning, former basketball player. And let me tell you, that presentation was well received, and it was a great service to the community. So I'm glad to see that the government is concentrating on health and men's health.
That's wonderful, Dr. Collier. We appreciate all of the great work that you do.
Yes, we do.
Thank you, Maria.
We love you, Dr. Collier.
Thank you so much.
We love
Feet
you.
be looking like Ugg boots.
I can be reached on all social media at AskDRMJ. Go to my YouTube channel and subscribe. Don't just go to it. Subscribe to Ask Dr. MK for various videos on topics. Go to my website, lipodrops.com, where you can find information on things that help with fluid retention, make you healthy, and boost your immune system. And remember, these are
Stick
the
stay.
things of
Oh, sorry, I
MJ
was ready.
Not those of Rickey Smiley, the Rickey Smiley Morning Show cast or its production crew. Stick stay. Don't you
Stick
dare
stay.
go away. You listen to Dr. MJ on the Rickey Smiley Morning Show.
Hey.